Well, those are just some of the highlights of the National Health Policy, and I discussed the fine print, or at least tried to discuss the fine print with the Health Secretary CK Mishra. I started by asking him about how the government plans to meet the issue of raising funds. Remember, the government has decided that over the next few years, by 2025, in a phased manner, public spending will go up to 2.5% of GDP. Will this only be by way of budgetary support, or are there other avenues that the government is exploring to fund healthcare spending? Take a listen.
When we talk about public funding, we essentially are talking about budgetary support. We are almost looking at doubling what it is by 2025. Right now, we are about 1.2% of the GDP. We intend taking it to 2.5% of the GDP. It is essentially budgetary support with some elements of participation from other sectors as support activities to run the programs.
While you've decided to move up to 2.5% of GDP by 2025, and that's a step in the right direction, Mr. Mishra, but the fact of the matter is that this is still significantly lower, not just in comparison to the developed economies, but even emerging comparable economies where the health spend is significantly higher. How did you arrive at this 2.5% number, and is this the best that can be done given India's financial situation?
See, given the resources available and also keep in mind the size of the GDP of India, the resources that would be available are pretty large. We also have to look at the capacity to be able to get value out of what we spend. This is an optimum figure which we think will help us get to the policy parameters that we have set for ourselves. Health spending can never really be enough. But we want to do more and more, and the policy emphasizes that if we are able to do 2.5 by 2025, this will be a significant step in that direction.
Okay. If I could ask you about the alignment between the centre and the state, Mr. Mishra, how do you intend to bridge the gap between the goals that the centre has and the goals that the state has? Because at the end of the day, state governments really are in control when it comes to healthcare. We've seen different performance. States like Tamil Nadu and Rajasthan have done a good job as far as the procurement-based model is concerned. Others have lagged behind. So how do you bridge this gap between, A, the centre and states, and between what various states are doing?
See, it is a state subject, and the centre's primary job is to handhold and support the states in achieving these targets. As far as the policy is concerned, let me put it up front that each aspect of it has been discussed in detail with the states, and it is a policy where the state is totally on board and committed to implement this. The second aspect that you mentioned is actually something that is worrisome in the Indian health system. There are huge inequities between the states in terms of performance and also in terms of disease prevalence. There are states which have done much better and which have a capacity to do much better, and there are states which have not done so well. The policy aims at supporting, diagnosing the problems with the states which have not done well, focus on those areas, handhold, support those states to move ahead and reach the level which other states have reached.
If I could ask you, sir, in your assessment at this point in time, what are the critical challenges and, the big drawbacks that you see when you're assessing the performance of various state governments, and where is it that you would actually like to handhold to improve the performance?
See, it's about governance, it's about capacity to deliver, it's about focus, and it's about planning. And these are the aspects where we would like to handhold states to take them in the right direction, which is agreed by both sides.
Okay. So you're saying that there is an agreement between the centre and the states, and hopefully as you roll this policy out, you will be able to improve state-wise performance. But, I was listening to the health minister, and he seemed to suggest that there are no dearth of funds for healthcare, but the problem is actually a different one. The problem is spending that money. Where are you struggling, sir?
We've done extremely well over the last couple of years in spending. The states have improved their capacities to spend, and we are doing very well on that. Therefore, it is the appropriate time when we get more resources to the center as well as the states to step up our health activities, because that capacity to spend is now getting created very fast, and the states which were not doing well have also started doing rather well.
Okay, so you see an improvement there when it comes to spending and improving the healthcare outcomes.